Welcome to the e-module on WHO classification of epithelial tumors of ovary. In this section, I'll be telling about clinical manifestation of epithelial tumors. The objectives are to describe clinical features of epithelial tumor and to have an overview of management of ovarian tumors. With some exception, the clinical presentation, treatment, and result of treatment are similar for all types of epithelial tumors within a given category or stage of the tumor. And these epithelial tumors are occur mainly in adults and they are uncommon in children and teenagers. In adults, it is chiefly seen in perimenopausal or postmenopausal women. 10% of patients with ovarian cancer will have inherited predisposition to develop the cancer, that is BRCA mutation, BRCA mutation, or Lynch syndrome. And more than 70% of women with ovarian cancer will have extensive extra ovarian spread whenever they come at the time of diagnosis. That is partly because the symptoms caused by epithelial tumors are vague and they are non-specific and they do not prompt for early diagnosis. They may be presenting later in stage. Most common symptoms of ovarian tumors are pelvic discomfort or pain, and the sensation of abdominal fullness or pressure may be there. They may be having gastrointestinal disturbance whenever the tumor is larger because of pressure on the GI tract. They can have increased urinary frequency, or occasionally they can present with menstrual abnormalities whenever the tumors are having some hormonal production. Whenever there is torsion or rupture of large cystic tumor, they can present with acute abdominal symptoms. And tumor which are greater than 15 centimeter, they will come out of the pelvis and they may be palpated by the patient. Ascites is the most suggestive symptom of carcinoma, and ascites is very rarely seen in case of benign tumors. So ascites needs proper investigation to rule out ovarian cancer. So, and also ovarian enlargement of any degree in women over 45 years of age raises the question of ovarian cancer, so they need further evaluation. And whenever the patient is undergoing sonography or any other imaging technique, if there are cysts with solid or complex architecture, it is particularly worrisome and you have to work up for ovarian cancer. So coming to overview of management, the treatment of ovarian tumors is primarily surgical. In benign tumors, cystectomy or unilateral salpingo-oophorectomy will be enough. There are no recurrences in case of benign tumors. Whereas in borderline tumors, hysterectomy with the bilateral salpingo-oophorectomy is the treatment of choice, but there is requirement of complete staging. If it is stage 1 confined to the ovary, it has got favorable prognosis. Ovarian cancer, they usually need surgery followed by chemotherapy. So the standard surgical treatment for ovarian cancer is hysterectomy, bilateral salpingo-oophorectomy, omentectomy, pelvic and para-aortic lymph node dissection, and staging biopsies and appendicectomy if indicated. So it is mainly the debulking surgery. So the main principle here is remove as much extra ovarian tumor as possible, which is called as cytoreductive surgery, to enhance subsequent chemotherapy or radiotherapy. So the standard treatment in ovarian cancer is surgery followed by chemotherapy. Surgery should be cytoreductive surgery. So the prognosis is most favorable whenever it is early stage, 1 to 2 stage has got good prognosis. And also some other factors like age, stage, tumor grade, peritoneal cytology, whether it is positive, it will impact the prognosis. In chemotherapy, the most commonly used drugs are carboplatin and paclitaxel. They are the first-line chemotherapeutic agents. They can also take targeted therapy. The targeted therapy drug is bevacizumab. The spread of the ovarian cancer. They most commonly spread by direct invasion into adjacent organs or through the peritoneal fluid into the omentum, peritoneum, or the serosal surface of the abdominal viscera and the diaphragm. Lymph node metastasis can also happen And distant metastasis is rare, but it can be detected, and most common site is lung or any other site. Coming to the prognostic factor, the only universally accepted prognostic factor is FIGO stage. You can also use TNM staging. In stage 3C and 4 patient, volume of residual disease, that is how much you have done the debulking procedure, really matters for prognosis. The other prognostic factors are cell type, histologic grade, and presence of tumor rupture. So to summarize, ovarian cancers are common in adults and they are uncommon in children. They spread commonly through direct spread. Surgery followed by chemotherapy is the standard modality of treatment. FIGO or TNM staging is the most important prognostic factor. These are the references. Thank you.